concerns around how the National Health Insurance Fund will be paid for and what the future for medical aids will look like remain. But in the interim, how do all the stakeholders affected by the transition from the current healthcare system to the NHI adapt in the face of much uncertainty? Well, to give us his take on possible ways to navigate this transition, I'm joined by Kevin Aron. He's a principal officer at Medshield Medical Scheme. Thank you very much for joining us, sir. So for the NHI to get up and running, it has to go through two phases, each over a certain time period. Just outline those phases for us and what's supposed to happen.
Yeah, good afternoon. So I think your question is very pertinent. And in fact, one of the things that is very uncertain is what are these two phases and are the timeframes realistic? It's our view, and certainly my view, that we welcome an NHI. I mean, I think at the end of the day, one shouldn't forget that people who are on private medical aids are actually paying for their medical aid contributions out of after-tax income. So, if the government is able to implement an NHI that's effective and able to provide high-quality, affordable healthcare to the whole of South Africa, I don't think anyone, including principal officers of medical schemes, would be averse to that. The real issue is the lack of detail in these two phases, and what it's going to cost. I want to make a point as well that, the reality is that the public healthcare sector is pretty broken, to say it mildly. There are some hospitals that are operating efficiently, but very few. So, even in these two phases, trying to implement a national health insurance, when you have a public healthcare state system, especially at hospital level, which is very, very broken at all levels, infrastructure, management, quality of care, quality of nursing, and most importantly, health outcomes, doesn't actually make any sense. So you've got to actually get the public healthcare sector up to a level where it at least equates to the private healthcare sector, and then you can start looking at how do you phase in a national health insurance.
Yeah, Kevin, let me come in there. Section 33 of the NHI Act pretty much does away with medical aid schemes in the exceptional cases where the NHI fund doesn't cover certain medical procedures. So, of course, that means that the likes of your medical scheme would be concerned about the future. So what is it that you need to be doing in the interim to try and get more certainty around that? Because, of course, the first thing that you mentioned was that there is no direction or certainty about what's going to happen.
Yes, that's a very good question. So we are members of the Board of Healthcare Funders, which is largely the industry body that represents medical schemes. And we work through them in terms of an industry body, in terms of trying to get that level of certainty. And that certainty would then allow us to actually start strategizing in terms of what would be the future of medical schemes. Section 33 basically says that private medical schemes would only be able to provide services that effectively are not provided within the national health insurance. But it doesn't speak at all, for example, would the fundamentals of a medical scheme change? So, for example, would the issue around prescribed minimum benefits fall away because essentially that's now covered under the NHI? To what extent could medical schemes almost morph themselves into more health insurance businesses, offering medical health insurance? And I think what you've seen throughout the world where NHI has been enacted, like in Australia, such as in the UK, for example, and even Germany, there are people who still elect, notwithstanding an NHI, that they actually want to still be part of a private medical scheme or medical insurer, for the simple reason that generally under an NHI, especially for elective surgeries, historically we've seen worldwide that people still wait a very long time to have their procedures. They have to wait in a long queue before they get done. Whereas, if they part of a private medical insurer and you want a hip replacement, you can have that done immediately. So there is still going to be a future for medical schemes, in my opinion, no matter what. But, to what extent that the medical scheme will actually look like, to what extent they'll be able to allow certain type of products, to what extent they'll be able to enter into insurance type of arrangements, that is all completely unclear, and it makes it very, very difficult for long-term strategic planning.
Indeed. Aron, unfortunately, we've run out of time. I do have more questions to ask you, but we don't have enough time. But thank you very much for speaking to us. That was Kevin Aron. He's Principal Officer at Medshield Medical Scheme.